Okay, so to be able to recognize which of the arteries are affected in ECG, first let's just draw out the different leads that we see. So firstly, we've got the 1, 2, and 3. Okay, next we'll just write down the AVR, AVL, and AVF. Okay, so after that we go for our V1, V2, V3, V4, V5, and V6. So what we want to do here is just to be able to recognize which of these leads are showing what part of the heart, and therefore which arteries supply them. So let's just use this mnemonic Lysol or Lisa L. So Lisa, and I'm not going to write the L because L stands for lateral anyway, so we're going to have that just here anyway. So what I've written down there is lateral, inferior, septal, and anterior. So let's start with L. So we'll highlight that in yellow just to show you which ones are lateral. Now, how I like to do it is just to go diagonally from 1 to AVL. So that's my L. As soon as you recognize this pattern, and if you're able to memorize this pattern, it'll be a lot easier just to memorize how different leads show different sides of the heart. And if you do remember physically where those leads are, then it does become a lot simpler, but this is just another way of pattern recognition. So there's your L, or at least part of your L, because it's Lisa L, isn't it? It's not just Lisa, but for the purposes of this, I've written just Lisa. So it's Lisa L, or Lysol. So there's your L. Now we're going to go for our I, which is the inferior part of the heart. And it's like a little shoe shape. So there we go. Yep. Now we need our septal, the S, L-I-S. So let's go with red. So the way I like to do this is just like a pairing. So 1 and 2 are a pair. 3 and 4 will be a pair. 5 and 6 will be a pair. So we've got L-I-S so far. So L-I-S. We need our A, and as I said, 3 and 4 will be a pair, so let's do that in pink. Oh. There we go. And then finally we have our 5 and 6 as a pair. I'm doing this in yellow because our anagram, the mnemonic is Lisa L, or Lysol. L is just the same thing, so both of those are L, if that makes sense. So let's go on here and just note down what we've written. So we have lead 1, AVL, V5, and V6 as our lateral leads. For our inferior leads, we have 2, 3, and AVF. For our septal leads, we have V1 and V2. And then finally, for our anterior leads, V3 and V4. So there we've been able to match up what side of the heart they all represent. But of course, now we need to know exactly which artery they supply. And I'm just going to note it down here, which ones they supply, and then I'll go back and show you exactly the branching structure of the arteries involved. And we'll talk a little bit about the veins as well. So the lateral side of the heart, now these are obviously lateral, so they're on the sides of the heart. Which artery can you remember that wraps around the side of the heart? And that's the circumflex, which comes off the left coronary artery. So circumflex. So that's true of all of the lateral leads, including this, this, and this. Then we have the inferior part. So which artery supplies the posterior side of the heart? I know it says inferior here, but the way I remember, I think it might also be posterior, but the one that supplies that side is the right coronary artery. Now, septal and the anterior side are actually supplied by the same one. Can you guess what that might be? That's the left anterior descending. So don't worry if that doesn't make too much sense at the moment, because we'll go back and look at the structure of the heart and the course of the arteries, and hopefully that should make it a bit more easy to understand. So let's go up. Yep. So here I have it again, and here is the anterior and posterior view of the heart. I've not shown the vena cava properly or the pulmonary trunk or anything, so we're just going to focus on the aortic arch. And why is that? Because that's where you get the blood vessels or the coronary artery coming off of. So let's get a bit of a thicker line. Yeah, that's thick enough. So we're getting two sides, aren't we, coming off of there? So two different main arteries. So that's the right coronary artery, because we're on the right side of the heart, and the left coronary artery, because we're on the left side of the heart. Now, as you might recall, the lateral side, as we mentioned, is supplied by the circumflex artery, and that's one that kind of wraps around the side, and it goes around the side of the heart. And then we have the anterior side and the septal side supplied by, that's right, the left anterior descending. And then from the right coronary artery, we have the marginal artery, and the right just continues and goes posteriorly. So let's just label that up for clarity. Right coronary artery. This is the marginal. This is the left anterior descending. And this is a circumflex artery. So, as you may know, dominance is decided by which of these sides gives off the posterior interventricular or inferior interventricular artery. Now, in most cases, it will be the right coronary artery, in fact, and that will happen just posteriorly. So we'll show that on the posterior view. But in some cases, people will be left artery dominant. So left-sided dominant people will give off the PIVA, or the inferior interventricular artery, from the circumflex, because that's the one that goes around the back. So let's have a look at the back here, and we'll also have a look at the veins while we're on here later in a minute as well. So just to orient ourselves. So the left circumflex artery is coming round there, sort of. Now, I'm not doing it accurate to the regions, so please take that into account, because I'm not a very good artist. And we have the right coronary artery coming around the back as well, don't we, like I said. So let's just say it comes around here, and then it's giving off that, it's dominant, right dominant, so we're going to give off that inferior interventricular artery. So if we were left dominant, it would come off the circumflex. But in this patient, we're going to say it's a right dominant. Now, let's remove these for a minute and just think about the sinus, the coronary sinus. So coronary sinus will be where the veins drain into, and we're going to be thinking that it drains into the right atrium, aren't we? So if that's left ventricle, let's just say it's there. I don't know where it is. Well, it'll take me a minute, but we'll just say it's over here. So that's the coronary sinus, and you've got three main veins, don't you, that come off it, that we need to know about. So let's just draw those on. So there's one here. So there's one here, one here. And how do we remember exactly which vein is which is the great, which is the middle, which is the small? Well, we got middle easily because it's in the middle. So we'll just add that on there now. Middle. Now we're left with deciding which is the great and which is the small cardiac veins. So the way I like to remember it is with Mr. Biggie Smalls over here. So if you just think about Biggie Smalls, the great cardiac vein will be on the left side of the heart. Remember, this is a posterior view, so left is on the left, on our left, and right is on our right. And therefore the small cardiac veins will be there. And there you have it, really. So there's the kind of branching structure. Although actually we missed one thing. The circumflex artery can also give off a marginal artery of its own. So you have a left marginal artery as well coming off the circumflex. So if we go back just a second, apologies. Let's say this is the circumflex. You can get a marginal artery coming off there too. And there we have it. Hopefully that makes a bit more sense. And yeah, that's it. Thank you for watching. Bye bye.